Your body is doing an amazing job growing a new life. And to do this, it needs plenty of water. Water is life, not just for you, but for the precious baby growing inside your womb. When you drink enough water, you help your body make a special fluid called amniotic fluid. This fluid is like a warm, safe, and soft cushion for your baby. It is the world your baby lives in for 9 months. It is very important for your baby's health and safety. Keeping this watery world full and healthy is one of the most important things you can do during your pregnancy journey. This special fluid does many things. It protects your baby from bumps movements, keeping them secure. It also helps your baby's lungs, muscles, bones grow strong and healthy. The baby breathes, swallows this fluid, which is like practice for life outside the womb. When there is not enough of this fluid, a condition called oligohydramnios can happen. This can sometimes be linked to the mother not drinking enough water, which is called dehydration. We want to make sure your baby has a big, comfortable, water-filled home to grow in, and staying hydrated is a key part of that. Think of the amniotic fluid as a protective bubble. It keeps the umbilical cord, your baby's lifeline, from getting squeezed. This cord brings food oxygen to your baby from you. Your baby also needs space to move around, to stretch their little arms, little legs. This movement is very important for their muscle skeleton to develop correctly. A good amount of fluid gives them the freedom to wiggle and grow, preparing them for a strong and healthy start in life. So, why is this so important to talk about? Because sometimes life gets busy and we forget to drink enough, or maybe morning sickness makes it hard to keep anything down. Understanding how your water intake directly affects your baby's environment can empower you, and it helps you make small, simple changes that have a huge impact on your baby's well-being. This essay will guide you through understanding dehydration in pregnancy, what causes low fluid, and the simple things you can do to protect your baby and keep them safe in their watery home. Oligohydramnios is the medical name for having too little amniotic fluid around your baby. Imagine a fish in a small bowl instead of a big, roomy tank. The fish has less space to swim and might not be as healthy. It is the same for your baby. When the fluid level drops too low, it can create problems. Simple diagram: healthy versus low amniotic fluid. Your doctor or midwife measures this fluid during an ultrasound to make sure your baby has enough space to grow and thrive. They watch for this carefully, especially in later pregnancy, to ensure your baby's safety and well-being. Your body is constantly making and recycling amniotic fluid. A big part of this fluid comes from the baby's own urine, but it all starts with you. The water you drink travels through your body and across the placenta to your baby. If you are dehydrated, your body doesn't have enough extra water to send to the baby's environment. This can cause the fluid level to drop. That is the direct link. When a mother is dehydrated, her whole system, including the baby's life support system, can feel the effects. It shows how your health is directly connected to your baby's health. Dehydration isn't the only cause of low fluid, but it's often a contributing factor you can influence. Doctors will also check for other medical reasons. Still, staying well hydrated is a foundational step. For example, Sarah was told her fluid was a bit low at 34 weeks. Her midwife advised doubling her water intake and resting more. At her next checkup, the fluid level had improved. When dehydration is the main cause, increasing fluids can often help. Your body is smart and resilient. By giving it the water it needs, you are directly helping to refill your baby's protective cushion. It's a simple but profound act of care. Drink enough throughout the day to support your pregnancy and give your baby the best environment to grow in, up until the day you get to meet them. While not drinking enough water is a common reason for dehydration, several other factors can lead to low amniotic fluid during pregnancy. It's important to know these causes, so you and your healthcare provider can address them. One major cause is an underlying infection. Infections in the uterus or genital area can cause inflammation that affects amniotic fluid production. Your doctor will check for signs of infection. These infections need treatment to protect both you and your baby. Another important cause is maternal illness. Fever, vomiting, or diarrhea can make your body lose fluid very quickly. This is common with morning sickness in the first trimester, but it can happen at any time. Conditions like untreated diabetes or high blood pressure can also affect how your body manages fluids. Taking care of your health and managing pre-existing conditions is crucial. Main causes: poor hydration. Main causes: maternal illness. Main causes: infections, uterus, vagina, or urinary tract. Main causes: placenta problems, when the placenta isn't working correctly. Main causes: baby's kidney issues, when the baby isn't producing enough urine. Main causes: leaking membranes. You might notice a trickle and not be sure if it's urine or amniotic fluid. Anytime you suspect your water might be leaking, call your doctor or midwife right away. They can do a simple test to check. Finally, sometimes the cause is related to the baby's development, like kidney or urinary tract problems. This is less common, but your doctor will look for it during detailed ultrasound scans. Your body often sends you signals when it needs more water. During pregnancy, it's especially important to pay attention to these signs. One of the first things you might notice is feeling very thirsty. This is your body's most direct way of asking for more fluid. You might also notice that your mouth feels dry or sticky. Another clear sign is the color of your urine. Well hydrated, pale, straw-like yellow. Dehydrated, dark yellow or strong smell. Drink water right away. Beyond thirst and urine color, there are other symptoms. Feeling unusually tired or sluggish. Dizziness or lightheadedness, especially when standing up quickly. Headaches from lack of fluids. These signs mean your body needs more resources, especially water. Drink a glass of water. It can make a big difference. When you tell your doctor about your symptoms, or if they have a concern, they will do a few simple and painless tests to check on you and your baby. The first step is usually a physical exam. Your doctor or midwife will measure the size of your uterus from the outside. This is called the fundal height measurement. If the measurement is smaller than expected for how many weeks pregnant you are, it could be a clue that the fluid level is low. They will also talk with you about how you're feeling and any symptoms you have noticed. The most important test for checking amniotic fluid is an ultrasound. This test uses sound waves to create a picture of your baby inside the womb. It is completely safe for you and your baby. The person doing the scan, called a sonographer, will measure the pockets of fluid in different parts of your uterus. They add these measurements up to get a number called the amniotic fluid index, or AFI. This number tells your doctor exactly how much fluid is there and whether it is in a healthy range. Another helpful tool is a Doppler ultrasound. This is a special kind of ultrasound that checks the blood flow between you, the placenta, your baby. It specifically looks at the blood moving through the umbilical cord and in the baby's brain. This test helps the doctor see if the baby is getting enough oxygen and nutrients. If the fluid is low, a Doppler scan can give reassurance that the baby is still doing well despite the smaller space. It helps your doctor decide on the best plan to keep your baby safe. Finally, your doctor might do some tests to look for a cause. This can include simple tests for infections. They might take a gentle swab from your vagina, similar to a pap smear, to check for any bacteria or yeast. They will also likely test your urine to look for a urinary tract infection. In some special cases, if they need a very detailed look at the baby's body, a more advanced fetal scan might be recommended. These tests help your doctor understand the whole picture so they can give you the right care. That's basically it. If your doctor finds that your low fluid is caused by simple dehydration, the treatment is often straightforward and can be done at home. The main instruction will be to drink more fluids. This means more than just water. Coconut water. Herbal teas that are safe for pregnancy. Broths. Eating foods with high water content also helps a lot. Watermelon, oranges, berries, cucumber, celery. These foods hydrate you and provide vitamins for you and your baby. Your doctor will likely give you a clear goal, a certain number of glasses or liters each day. Carry a large water bottle with you as a reminder. Sip water steadily throughout the day, rather than gulping a lot at once. For a simple meal plan, breakfast, oatmeal made with milk or water. Lunch, a big salad with lots of fresh vegetables. Dinner, enjoy a soup or stew, snack on fruits. Snack on yogurt. Besides drinking more, rest is very important. Your doctor may advise reducing activity or even bed rest. Resting reduces fluid loss through sweat and redirects resources to support pregnancy. Resting on your left side can improve blood flow to the placenta and your kidneys. That helps your body produce amniotic fluid and deliver what your baby needs. Finally, you will need to be monitored more closely. Your doctor will likely schedule more frequent checkups, weekly ultrasound to measure amniotic fluid, a Doppler scan to check the baby's well-being. These regular checks are very reassuring. They let your doctor see if the treatment is working and ensure your baby stays healthy. Careful monitoring means the team can act quickly if things change and give you the support you need. Sometimes drinking more water and resting at home is not enough, especially if the dehydration is severe or caused by another medical problem. In these situations, your doctor will recommend that you go to the hospital for care. This is not to scare you, but to give you and your baby the extra support you need to get better. One of the main reasons for hospital care is if you are so sick from vomiting or diarrhea that you cannot keep any fluids down. In the hospital, you can receive fluids directly into your vein through an IV drip. This IV hydration can work wonders. It bypasses your stomach and delivers fluids and electrolytes right into your bloodstream, rehydrating your body much more quickly than drinking can. This can help you feel better very fast, and also helps increase the blood flow to your uterus and placenta, which in turn can help increase the amniotic fluid. While you are in the hospital, the nurses and doctors can also give you medicine to stop the vomiting or treat a fever, helping to fix the root cause of the fluid loss. While you are admitted, you and your baby will be monitored very closely. This means they will likely check your baby's heart rate continuously for a period of time using a fetal monitor. They will also do regular ultrasounds to see if the amniotic fluid level is improving with the IV fluids. The medical team will keep a close watch on your vital signs, like your blood pressure and temperature, to make sure you are stable and recovering. This constant care provides a safety net, ensuring that any potential problems are spotted and managed immediately. If the doctors see that the baby is in distress or danger, they will talk with you about the next steps. If the fluid levels remain very low and there are concerns about the baby's health, a planned delivery may be the safest option. This might mean inducing labor or planning for a cesarean section. The decision will always be made with the baby's safety as the top priority. Going to the hospital gives your medical team the ability to provide this higher level of care and make the best decisions for a safe outcome. If severe dehydration and very low amniotic fluid, or oligohydramnios, are not treated, it can unfortunately lead to some problems for the baby. The amniotic fluid plays a huge role in the baby's development, so when there is not enough of it, this development can be affected. One of the biggest concerns is the baby's lungs. The baby practices breathing by swallowing amniotic fluid, which helps their lungs mature. Without enough fluid, the lungs may not develop properly, pulmonary hypoplasia. That can cause breathing problems after birth. The fluid also acts as a cushion, giving the baby room to move. When the fluid is very low, the baby can be compressed inside the uterus. That can affect muscle and bone development. For example, developmental defects can appear in the baby's limbs or in the baby's face. The baby needs to stretch and move to build strong bones and joints. A lack of space restricts movement, so restoring fluid levels is critical. Another serious risk is the umbilical cord. Fluid helps the cord float freely and avoid being squeezed. If fluid is very low, the cord can be compressed between baby and uterine wall. The best way to deal with dehydration is to prevent it from happening in the first place. Taking a few simple, proactive steps every day. They help you maintain a healthy pregnancy and a safe environment for your baby. The most important tip: stay well hydrated. Make it a habit to drink water throughout the day. Aim for at least 8 to 10 glasses. You may need more if it's hot, or if you're exercising. Carry a water bottle as a visual reminder. Try infusing your water with lemon, mint, berries. Eating a healthy, balanced diet is also key. Focus on fresh fruits and vegetables. They have high water content and essential vitamins. A healthy diet supports overall well-being and fluid balance. Treat illnesses promptly. If you get a fever, or vomiting, or diarrhea, contact your healthcare provider. Practice good hygiene and safe sex to prevent infections. Urinary tract infections, vaginal infections. Always wipe from front to back. Wear breathable cotton underwear. Talk to your doctor if you notice unusual discharge. Itching, burning. If you have pre-existing conditions like high blood pressure or diabetes, work closely with your doctor to manage them during pregnancy. A healthy mom is the foundation for a healthy baby. Remember, dehydration and low amniotic fluid are often preventable and treatable. Listen to your body. Drink plenty of fluids. Eat well. Contact your doctor or your midwife if something feels wrong. They are your partners and there to support you. Taking care of yourself is the best way to take care of your little one.